Okay. Now our next session is male catheterization. Basically, I'm studying and I'm preparing myself for MRCS Part B, and I had completed some part, but still some remaining is there. For this part, I'm planning to go live on YouTube so that later on, if I want to see, I can go back to there through YouTube. I know there are other options are there, but just I'm trying this one. It is not for any commercial purpose. And this is only for the learning purpose. That's okay. Yeah. This file contains 34 pages on 27 lines. I can finish this one. Okay. So in general, introduce yourself and patient identification. introduce yourself. Patient identification, consent, explanation, risk and benefits. Explain the procedure in layman's terms. Indication for procedure, risk if not performed, alternatives, what the procedure entitles, complications, failure, need for alternatives, false passage, hematuria, pain, and bladder spasm, optional need for monitoring urine output, post-catheterization, and diuresis. I want to review patient's file. I want to review patient's file. Safety. Okay. WHO checklist. Patient's history. Previous catheterization. Did you have that procedure before? Allergy. Do you have any allergy to latex or lidocaine anesthetic solution? Is there any contraindication? Okay. Equipment. Second, examiner may act as an assistant and offer to get a trolley ready for you. Examiner may act as an assistant and offer to get a trolley ready for you. Basic catheter bag, kidney dish, gallipot, gauze, and sterile wrap. Kidney dish, gallipot, gauze, and sterile wrap. Skin preparation solution. Sterile water is acceptable. Yes. Again, second, examiner may act as an assistant and offer to get a trolley ready for you. Basic catheter bag, kidney dish, gallipot, gauze, and sterile wrap. Skin preparation solution. Sterile water is acceptable. A 2 pair of sterile gloves. Appropriate urinary catheter. 14 to age. Is probably the most appropriate. Read expired date on catheter. Again, appropriate urinary catheter. So 14 age is probably the most appropriate. Ensure that it is not a female catheter as these are shorter. 10 ml syringe with 10 ml water, not saline. 10 ml syringe with 10 ml water if not supplied with catheter. Installed instillate anesthetics, antiseptics, lubricant, minimum 10 ml. Appropriate catheter bag, large night bag or a urometer. Large night bag or a urometer and forceps. Positioning. Patient should be as flat as possible to perform the procedure. Plastic module will be there and the procedure begins. Wash your hands, prepare your equipments, open catheter, instillation, and gloves sterile filled with a non-touch technique. Prepare your equipment, open catheter, installate and gloves sterile filled with a non-touch technique. Pour saline into sterile port. Pour saline into sterile port. Place catheter drainage bag at the end of the bed. Place catheter drainage bag at the end of the bed. Obtain adequate exposure. Cleanse hand with an alcohol-based agent and first pair of sterile gloves. If stayed in steam, don't do it. Cleanse hand with an alcohol-based agent and first pair of sterile gloves. Wrap the patient. Use one hand to retract the foreskin using a gauze as a sling and clean the foreskin. Use one hand to retract the foreskin. Use a gauze as a sling and clean the foreskin. Circumpolar manner, glans and meatus. Separate swab for each using forceps if available. Insert instillation into the urethra and wait for 3 to 5 minutes. Insert instillation into the urethra and wait for 3 to 5 minutes. Here, inform patient, I will put gel inside your penis that will be irritant at the beginning. Change to second pair of sterile gloves. Place the kidney dish or collecting dish between the patient's leg. Remove packing on the tip of the catheter and advance the catheter with the penis holding held pointing to the ceiling with gentle traction. Try to roll only by rolling in module. Remove packing on the tip of the catheter and advance the catheter with the penis held pointing to the ceiling with gentle traction. Pass the catheter all the way to the hilt and wait for urine to drain. Pass the catheter all the way to the hilt and wait for urine to drain. After urine has started to drain, inflate the balloon with the appropriate amount of sterile water, usually 10 ml, but some such as three-way catheter require 30 ml. Usually 10 ml, but some such as three-way catheter require 30 ml and withdraw the catheter gently. Replace the foreskin if present. Dry and cover the patient before asking them to redress. Dry and cover the patient before asking them to redress. Dispose the equipment in appropriate bin. Measure the amount of urine draining after an adequate period of time, 5 to 10 minutes, and obtain a culture sensitivity for microscopy, culture and sensitivity. Document the procedure in the notes and write a request for culture and sensitivity. So, drape the patient and place a collecting vessel in between the legs. Clean the penis with a gauze with one hand and another hand holding the right of the penis as like a sling. Insert instillagel. 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 Insert instillagel. Insert instillagel. Insert instillagel containing alcohol called local anesthetics. Advance the catheter tip from the sleeve. Wait for urine to flow into the collecting vessel. Wait for urine to flow into the collecting vessel. Inflate the balloon using 10 ml of saline. Inflate the balloon using 10 ml of saline. Okay. So, what is a catheter? It is a surgical apparatus. It is a surgical apparatus. It is a sterile hollow tube that is inserted into the body. It is a surgical apparatus. It is a sterile hollow tube that is inserted into the body. It is a surgical apparatus. It is a sterile hollow tube that is inserted into the body that may be self-retaining by balloon tip or fixed to skin to prevent dislodgement. It may be self-retaining. It may be self-retaining by balloon tip. It may be self-retaining by balloon tip. It may be self-retaining by balloon tip or fixed to skin to prevent dislodgement. Used to drain uh, to drain UC, urinary chemicals or what, or insert into vessel to infuse drugs and fluid to drain urine collection or UC to drain urine. Answer before like this? No. To drain UC. Okay. To insert into vessel. To infuse drugs and fluids, or as a channel for monitoring device as CV line. If unable to pass catheter, what will you do? Use adequate local anesthesia and gel. Consider different size catheter, and larger size may be easier to insert in BPH. More stiff, easy to push. Consider different size. First, use adequate amount of local anesthetic and gel. Consider different size catheter. Larger size may be easier to insert in BPH. More stiff, easy to push. Consider cold tip catheter. And do ultrasound. Call urologist. Commonest cause of anuria, blocked catheter, other causes. Commonest cause of anuria, blocked catheter, other causes. Urethral stricture, benign prostatic hyperplasia, bladder outlet obstruction, or bladder neck obstruction, or bladder stone. Acute renal failure, hypovolemia. Commonest causes of anuria, blocked catheter. Commonest causes of anuria is blocked catheter. Other causes: urethral stricture, benign prostatic hyperplasia, urethral stricture, BPH, bladder outlet obstruction or bladder neck obstruction or bladder stone, acute renal failure, and hypovolemia. Commonest causes of blockage is gel. What would you do if no urine drains after catheterization? Re-evaluate presence of urine in bladder by marcasing the suprapubic region. Re-evaluate presence of urine in bladder by marcasing the suprapubic region. If you have not done this already, okay, apply suprapubic massage, aspirate urine. If no urine, I will do flushing and aspiration. Aspirate urine. If no urine, then I will keep flash and again aspirate. Nothing should be introduced until you see urine. If still no urine, first I will check fluid chart. Consider hypovolemia. Keep fluid challenge, that is 500 ml in 15 minutes and flushing by 50 ml. Ask and guide. Okay, flushing by 50 ml. and aspirate. Okay. If still no urine, consider hypovolemia. Give fluid challenge 500 ml in 15 minutes. If no hypovolemia, from fluid chart, take out the intake chart. Why? Take out the, okay. If no hypovolemia from the fluid chart, take out the ice catheter. Why? False passage, catheter deep in urethra, not bladder, not a true palpable bladder, suprapubic mass. You insert the catheter, it drains no urine, and you therefore remove it. You then examine this patient's abdomen and there is no suprapubic mass. What is the differential diagnosis? Bladder mass not catheterized. Bladder was not catheterized appropriately. Malignancy from bladder, prostate or colon. Pelvic collection or abscess. Mesenteric cyst. Large iliac aneurysm. Bladder was not catheterized appropriately. Malignancy from the bladder, prostate or colon, and pelvic collection or abscess, mesenteric cyst, large iliac aneurysm. Okay. If still anuric with normal ultrasound and normal fluid chart. If still anuria with normal ultrasound, acute renal failure causes like pre-renal, renal, and post-renal. Pre-renal, decreased renal perfusion by hemorrhage, dehydration, burns, sepsis, mainly hypovolemia. Pre-renal, decreased renal perfusion by hemorrhage, dehydration, burns, and sepsis. The renal nephrotoxic drugs like NSAIDs, diclofenac, ACE inhibitor, acute cortical necrosis, aminoglycosides, and contrast. Again, renal cause, nephrotoxic drugs. Examiner asked what will be helpful for you from history. History of hypertension, diabetes, patient take NSAIDs, nephrotoxic, antibiotic, aminoglycosides. Yes. So NSAIDs like diclofenac, ACE inhibitor, causes acute cortical necrosis, aminoglycoside, and some contrast. And post-renal, ureteric and lower urinary tract obstruction. Ureteric and lower urinary tract obstruction. Now, complications of catheterization, allergies, infection, urinary tract infection, urethritis, pyelonephritis, and urethral injury. Allergies, infection, urinary tract infection, urethritis, pyelonephritis, and urethral injury. Okay, now chest drain insertion. So we have 4 pages remaining. Before we jump to that, I would like to go through all again in our Word pop-up file. So it is more or less same. Okay, male catheterization. There is an actor beside the module. The examiner will help you. You should mention from beginning your sterile and non-sterile areas or the examiner may tell you this is your sterile area and the others area non-sterile. So start to prepare your equipment. You should mention the indications and the complications of the procedure. Introduction. Good morning, I'm Dr. Sudhanshu, one surgical doctor. Could you please confirm your name and age, please? Today I have been asked to, so first part introduction done, then patient identity confirmation. Now explain what I'm going to do. Today I have been asked to insert an elastic tube in your external genitalia to allow you to pass urine for or for monitoring of your urine output. Today I have been asked to insert an elastic soft tube in your external genitalia to monitor your urine output. This will be under sterile technique. This will be under sterile condition. This will be under sterile condition and using numbing agent. This will be under sterile condition. This will be under sterile condition and using numbing agent. So typically you will not feel any pain. It may carry some complications like bleeding, infection, and false passage. Are you okay with that? Could you please give me a written consent? Could you please give me a written consent? Now, safety. Do you have any previous have you ever had the same procedure before, or any machine or any device inserted in your genitalia before? Any operation done before, any previous pelvic surgery? I want to check WHO checklist. I want to check WHO checklist. Confirm patient's ID on bracelet procedure site of the procedure to detect. If the patient takes any blood thinners, if the patient takes any regular drugs, especially the blood thinner, if he has allergy to any of the medication, especially iodine, latex, or local anesthesia, then I will wash my hands and prepare my equipments. I will wash my hands and prepare my equipments. I will